Yeah, good morning, good afternoon, good evening. Any part of the world you are listening to me. I'm comrade Dr. Eric Olubenga Eniola. By special grace of God, I'm the Lagos State Secretary of the Association of Integrated Medicine Practitioners. But I find it necessary for us to rub mind. I'm not dishing out lectures, but I'm only giving us my own idea on how some ailment can be treated. And I've synchronized the topic and the platform. How we go every Sunday, at least 2 hours per day, within the hour of 5 p.m. and 7 p.m. every Sunday. I know this will go a long way in our practice. I was supposed to be in a platform to put it in a major platform, but I decided to have a platform for it. I cannot use my own idea to disturb other people's peace and time. And that's why I choose anybody that think that he can join me in a lecture should join me. Having said this, the first in the list of the lecture is Fallopian tube blockage. Before I go in depth, what is fallopian tube? What is the dictionary meaning of fallopian tube? Before we talk about the blockage, let us talk about what is fallopian tube. It is one of two long, slender tuba that is connect the ovarian to uterus. Egg pass from ovaries through the fallopian tube to the uterus in the female reproductive tract. Note, there is one ovary and one fallopian tube on each side of the uterus. Now, what is uterus? Because when you're talking about the tube is connected to uterus, and it is two, one by the left, one by the right. Uterus is a female reproductive organ that is responsible for many functions in the process of implantation, gestation, and menstruation and labor. That's the definition of uterus. If you are not getting me, you can go back and so that's why I make it a video. I never make it a live program. I make it a video that after you watch it, then we'll now discuss after you watch the video. Because after this, we are going to go and go for proper practical. That's treatment of fallopian tube blockage. Now, it goes further. Fallopian tube are bilateral conduits between the ovary and uterus in the female pelvic. They function as a channel for auxiliary transport and fertilization, giving this role. The fallopian tube are core etiology of infertility as well as a target of purposeful surgical sterilization. What they mean is fallopian tube is fragile, is a tool that transports the egg that is being fertile to where it's supposed to go. And if this happens, maybe there's a blockage, can a woman get pregnant, or can a woman get conceived? The answer is yes, and the only way is through IVF. And a woman that have one fallopian tube can conceive as well, because it's going to use just that only one. You understand? What they mean by IVF is in vitro fertilization, which is done by specialists in the hospital. Now, let us now go to what is fallopian tube blockage. That is today, when you listen to my definition of fallopian tube, and when you listen to the function of fallopian tube, and come to tells you that what is fallopian blockage. Fallopian blockage is a situation by that fallopian tube is blocked. and cannot carry out its function as it's been designed by nature. What are the symptoms? What are the symptoms? What are the signs that you know that a woman is having a fallopian tube blockage? There's general pelvic pain at the abdominal, down abdominal part of a lady. It's general pelvic pain. When a woman during sexual intercourse feel a very big pain during sexual intercourse. 3, a foul smelling vaginal discharge. Smelling vaginal discharge from a woman. Those are some of the symptoms of fallopian tube blockage. We talk about fever, constant having fever. When a woman is said, let her go and conduct test. Maybe she has that problem. She will be nausea and vomiting. Severe low abdominal and pelvic pain. What causes fallopian tube blockage? It might interest you that that's common sickness that we just ignore, that we take antibiotics or what they call this thing. I don't remember so much the name of the antibiotics. I don't remember there's too much. No, I can't remember most of the name. I try to pick name because I'm used to natural plants in treatment of sickness or in treatment of bacteria. The common sickness that is common, they call it sarcoidosis inflammation. Sarcoidosis inflammation is called, we are just talking about gonorrhea. That gonorrhea bacteria that we normally use oh my God, I've forgotten. I don't know. I've forgotten this capsule, this common capsule that they will go and buy from pharmacy, and they will use it for some days, for about 7 days, to flush gonorrhea. Gonorrhea is the major problem that causes fallopian tube blockage. Gonorrhea, and for most female that have infertility today, that are not fertile, is as a result of the tube blockage, and 2, because of gonorrhea. Because gonorrhea is the major cause of tube blockage. It's the major cause. Now, how do we treat tube blockage? How do we treat fallopian tube blockage? I will take us on a common and simplest way of treating it. It is through oral. When you treat it through oral, it's faster within a week. By God's grace, you have a good testimony. First, we have what they call bitter melon. Why the part of the world I come from in Yoruba land in Nigeria, we call it bara. We call it bara. The English will call it bitter gum or bitter melon. That bitter gum or bitter lemon, bitter melon, you cut it and take off the seed out of it. When you take out the seed, you now cut it. You take about four bunch, you cut it in pieces, and put it in a pot. It's not compulsory you have to use clay pot. Any pot you can use any pot. Those days our forefathers used clay pot because there is no current technology of creating new pot, because those clay pot we use both in eating, in cooking, doing everything we are doing in good old days. But now, due to civilization, we can use we can use stainless pots. You cook it on the gas. You don't need to go and stress yourself to fetch firewood and inhale smoke. No, just put it in the gas. After cut about 4 of bitter melon, after taking off the seed, go and look for ash pot ash. In Yoruba we call bitter melon, we call it bara. Pot ash in Yoruba we call it eru ojuaro. And the third one you're going to look for is one is that you look for water that is being fermented, corn water that is fermented. Those who that sell agidi ogida water, they call it omidu in Yoruba language. Those are the three fundamental you need. Those are the three fundamental that you need. You now mix them together, boil it for about 30 to 45 minutes. You boil it for 30 to 45 minutes. After you boil for 40 to 45 minutes, allow it to settle and cool. Turn it in 5 liters keg. Give it to that person to take 2 times a day. 2 times a day. But if you want effective, you want it to be more effective, you can put what they call cow, just little cow, just put it when you are boiling it. If you want it to be more effective, just put cow. When you boil it very well, 30 to 45 minutes. After it's settled, put it in 5 liter keg. Let the patient take at least this 1 cup in the morning and 1 cup at night. It will flush and flush that place, and that fallopian tube will open. Now, before you do that, in case you have a patient that has fallopian blockage, there is methodology in treatment of fallopian blockage. First, you must have endeavored to treat that patient of infection. You must have treated that patient very well. After you have treated infection on that patient, you now open the tube. Because when you use this to open the tube without treating infection, you are just postponing an evil day. You don't need to postpone an evil day. Treat the infection from such patient first. After you treat that patient of infection, you now open the tube. That's how you can open tube blockage. In the next episode, I will show you practical how bara look like, how fermented corn water look like, and the ash from the burning stick in which you are going to mix together. I will do the practical at the next video. Thank you. I still remain comment Dr. Eric Olubinga Enola. I'm an orthopedic doctor. I specialize in treatment of heart, kidney, liver, infertility, fibroid, diabetes. Because there is relationship between infertility and fibroid. Thank you and God bless you. You're welcome.